A DIEP flap, or deep flap breast reconstruction, refers to a breast reconstruction technique where we transplant belly skin and fat to your chest to reconstruct breasts. So the skin and fat that's transplanted is the skin and fat that's below your belly button. So usually the incision involves your belly button, but for all practical purposes, the skin that you pinch along the lower aspect of your abdomen below your belly button is the skin and the fat that we use to make breasts. Whether or not you have enough tissue to make breasts that'll meet your reconstructive goals, we can talk about when I examine you. And if needed, we can always inject fat later. We can do fat grafting later to add volume to the flaps. We can also place implants underneath the flaps if needed. But let's focus on the deep flap operation. So, your belly skin and fat is transplanted to your chest. The tissue is kept alive by hooking up your deep inferior epigastric artery and vein, which are the blood vessels that feed that abdominal skin and fat. And those vessels are hooked up to your internal mammary artery and vein, which are blood vessels on your chest. So essentially we are transplanting your lower abdominal skin and fat to your chest, no different than a kidney transplant. And by hooking up those blood vessels under the microscope, that's what keeps the blood flowing to that tissue and keeps that tissue alive. If I were to transplant your belly skin and fat to your chest and not hook up the artery and the vein, all of that tissue would die. So this is what's called a free flap. And what that means is it's a flap of tissue with its own plumbing, and we are hooking up blood flow to that flap to keep it alive. We are transplanting it to another area of your body. Now, unlike a kidney transplant, this tissue is you. It is just your tissue, a piece of your body living in a different place. So you do not need to take immunosuppressants and other transplant medications because it is not that type of transplant. But it is transplanting your tissue from one area of your body to another. The advantage of this technique is that you get a flatter abdomen, and you also have breasts made out of your own tissue. Your own skin and fat makes up your breasts. Now, how much skin we use depends on how much skin you need, and how much fat we use depends on how much volume you need. So we can tailor that flap based on what your chest needs to reconstruct a beautiful breast. The deep flap breast reconstruction operation can be performed at the same time as your mastectomies or at a later date, however, decades after mastectomy if needed. So we can perform the deep flaps immediate or delayed or staged immediate, which is about 3 weeks after the mastectomies. The deep flap operation takes approximately 6 to 8 hours to do both sides. Most patients spend 48 hours in the hospital following the operation. Some patients will spend 72 hours or 3 days, but we do our best to get you out and have your pain controlled and basically get you ready to go home after 2 days. And so most of our patients do go home after 48 hours or 2 days. For the first 1 to 2 nights, you are in the intensive care unit. Not because you're sick and you need intensive care, but because we need nurses that can check the perfusion to that transplanted tissue very frequently. Initially, we have the nurses check the blood flow to those flaps every 15 minutes, then every half hour, then every hour, and then you can leave the ICU because the nurses only need to check it every 4 hours. So that's the reason for the initial ICU stay. For more information about the recovery after a deep flap breast reconstruction, check out my video that describes the recovery following a deep flap breast reconstruction. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.